Hi everybody, Dr. Elizabeth Yurth from Bodo Longevity Institute. So I want to spend a couple minutes today talking about a medication that I use really frequently in my practice, and that's called pentacin polysulfate. We've been using pentacin polysulfate now for about 3 years in our practice. Once it got approval in other countries, particularly Australia, and we sort of fast-tracked it here to the U.S. and were able to get some compounding pharmacies to make it for us. We were able to do that because pentacin polysulfate is an FDA-approved drug here in the U.S. under the name Elmiron. So it's FDA-approved as an oral medication for treating interstitial cystitis, which is a painful inflammation of the bladder. But interestingly, as an oral medication, or Elmiron, it really was not very effective in helping other issues. You need to be treated systemically with an injection. So the drug was utilized quite frequently in Australia, and we kind of fast-tracked it here and had really tremendous results with pentacin. So pentacin is a glycosaminoglycan that works on many aspects to address arthritis. So I know this is not a very clear slide, unfortunately, I'm sorry, but basically when we have these arthritic processes that start, most of you have heard me over and over again talk about how this is an inflammatory disease, that yes, it can be instigated by an injury. You may tear your ACL or you played too much football. But what really happens is you have this abnormal activation of inflammatory cells, elevation of inflammatory proteins. You start to see damage to the blood vessels, which creates this bone edema or changes to the bone itself. You have abnormal chondrocyte metabolism, abnormal synoviocyte metabolism. So there's a lot going on here that's causing both pain, but also a rapid progression of the arthritis. So simply putting people on anti-inflammatory drugs or doing steroid injections is not going to help that. It will temporarily help the pain, but not the long-term consequence, which is the joint is rapidly degrading into the point where you finally need a joint replacement. So can we stop that process? And yes, we need to work on all of those inflammatory pieces, and that's where pentacin comes in. So basically it's working on multiple mechanisms to not just help pain, but also to actually allow cartilage regeneration and repair of the joint, or at least halt progression. And then sometimes you can use other things like stem cells or platelet cells to help repair the damage that's already been done. So when you looked at the studies on pentacin, they found improvements in pain after really only 6 to 8 weeks of once to twice a week injections. And we do see that in some people. Some people have very rapid pain relief. Not everybody though. And like all studies, experience always speaks a little louder. So now that we've been using this drug for quite some time in patients, one of the things we've noted is that it seems the longer you're on it, the more benefit we see. I myself have been taking this medication for several years now, and I can tell you that I just keep getting more improvements in my symptomatology the longer I'm on it. So when patients get an early response in that first 6 to 8 weeks, it's working on some of the anti-inflammatory piece, but that's not really helping the degradation. So if you're early in your disease process, let's say you have mild arthritis and a lot of inflammatory pain from these inflammatory proteins being upregulated, then it's probably going to help relatively rapidly within a few months of treatment. But there's already a fair amount of damage that needs to stop or be repaired. It's likely going to take you longer. And in fact, when you look at the oral medication for bladder cystitis, they told people 6 months of treatment sometimes to really settle all the processes down that have gotten in there in the first place. And there's no reason to think that this would be different, that it may take up to 6 months of treatment to really start seeing a dramatic change, because you actually at that point start seeing a change in the chondrocytes and the synoviocytes themselves and filling in of bony edema, all those processes that in the long run are changing the overall mechanical derangement of the joint, not just changing inflammation. So I think, yes, 6 to 8 weeks. If you have an acute injury, if you're young and you have an acute injury, we want to use it then to stop the inflammatory process from causing progressive damage that we see after, for instance, an ACL tear. So those people lots of times will do 6 to 8 weeks of treatment. Or you're a young person who comes with me with mild inflammatory arthritis, probably 6 to 8 weeks is enough. If you're somebody like me who has years, I tore my first ACLs, 30 years ago, if you have longer than that, I guess, you have years and years of pain and damage, it's likely going to take you longer to see improvement. I will say most, now we've had so much experience with this medication, most, I would say 80 to 90% of people get improvement, but it takes time and patience to really get there. And what we'll see is the slow, steady gains. So this medication is wonderful. It's an injection you give yourself once to twice a week. It's addressing the root cause of the arthritis. It's reducing both inflammation and the progressive derangement that's causing the loss of joint space and your tailspin into knee and joint replacement. But the downsides are you probably need to be doing weekly injections for 3 to 6 months. And I personally will use the drug probably on an ongoing basis. I'll address quickly the maculopathy, so damage to the eye, that was seen with the oral drug Elmeron. It was really a dose-dependent response. And at the dose that we're using as a subcutaneous injection, it would take likely a high-dose injection 20 to 30 years of utilizing this drug on a regular basis to start seeing any of those changes. There also may be a difference in that when it's not orally metabolized, we don't see the same effects. So this medication has been used in horses for quite some time. When they looked at horses, they did not see this macular damage, even in horses who have been on the drug for quite some time. The drug is going to be available as a drug here in the US called Xylazil. It's been fast-tracked. It's in phase 3 trials, so we'll probably see it come to market in about 3 years. But in the meantime, we can get it for you. And I highly advise, if you have arthritis in your knees, your hips, your shoulders, your hands, multiple joints, this is a medication you need to be on, but you need to exhibit patience because it will take some time. That said, you have an acute injury, this is something you want to be on right away for like a 6-week course. You're a young person who has low-grade inflammation and not a lot of damage, probably a short course is going to be fine. I hope that answers some questions about penicillin.